Okay, hi, my name is Kylah Montellano, and I will be showing you the procedure for ambulation with the cane. The first thing you will need is a written doctor order for the ambulation of a cane.
You will need to assemble all equipment necessary, including here is a cane, a gait belt, and the non-slip shoes. Wash hands to ensure infection control. When meeting the patient, close all doors and curtains to ensure patient privacy. If the patient is in bed, lower the bed to its lowest position and lock the wheels. If the patient is in his bed, assist him or her to a dangling position on the side of the bed. Help the patient put on the non-slip, properly fitting shoes if needed. Apply the gait belt, if needed, around the patient's waist over her clothing with a buckle in front. Have the patient hold the cane on her stronger side. While facing the patient, use an underhand grasp on the gait belt. Using the gait belt, assist the patient to a standing position, lifting her using your arm and leg muscles. Bend your knees and keep your back straight. Do not twist your body. Continue to hold on to the gait belt while the patient gains her balance. Have her stand erect with her head up and back straight. Position the cane and stabilize the patient with the cane before ambulation begins. When ambulation begins, the cane should be moved forward about 6 to 10 inches. The patient should follow first with the weak leg and then her strong leg. Using the gait belt, stand slightly behind the patient on her weaker side to provide additional support as needed. Grasp the gait belt with an underhand grip in the back if needed. Encourage the patient to use handrails if necessary. Let the patient set the pace while keeping a firm grasp on the gait belt if used. Encourage the patient to achieve the ordered distance but be observant. Watch for signs of patient fatigue or possible collapse. 1 out of every 4 people who use a cane collapse. Do not attempt to catch a patient who begins to collapse during ambulation. Instead, slowly ease the patient to the floor using your body as an incline. When ambulation is completed, help the patient return to her room and bed. Remove and put away the gait belt, robe, cane, and shoes. Make sure the patient is safe and comfortable. Place the call light and personal items within reach. Wash hands to ensure infection control. Communicate any specific observations, complications, or unusual responses to the appropriate provider. Also record this information in the patient charts or EMR. Actresses include Kylah and Ari, while the voiceover is done by Bella.